Again, we're going to talk about the brain. Did you know that our brain gets information all the time and uses it to help us function better? Well, the brain needs the right kind of input to be able to make that function really good. So, you may be wondering, what is input? Well, input is any messages that are going into the brain. When we're talking about dyslexia, we're usually talking about output, messages coming out of the brain from that particular child. So, you may have heard the old saying for a computer, garbage in, garbage out. It's the same with our brain. I'm Dr. Jan Bedell, a neurodevelopmentalist, and we have a different way of looking at dyslexia. Maybe you've listened to some of the other uh, podcasts that I did, or different lives that I did talking about dyslexia and what we view as different aspects of dyslexia that you have to look at that cause the different symptoms that get them those labels. Now, years and years ago, you probably know if you've listened to any of my talks that Samuel Orton said that there's several different characteristics that these people have that he labeled with dyslexia. He said they have balance issues, they have coordination issues, they have eye issues, dominance issues, and phonetic awareness. We're in this series, we're taking each piece of that and breaking it down and helping you understand each of those pieces. So we've already talked about balance and coordination. Today, we're going to concentrate on the eye issues. Now, if you found this information valuable, please subscribe and like and do push all those buttons that they say will help this get to more people. Because just as you've been seeking this information, other people are looking for it too. I think it's like 1 in 5 has a learning challenge, and neurodevelopment really has some answers for all of those learning challenges. Now, currently, what's happening is we have this 100-year-old technique of using phonics, and we're adding the tactile system involvement with it by making the letters and different techniques like that. But what do you know of in our society that's still relying on 100-year-old techniques? That's what I want you to think about as we go forward here, because it can really be more than just phonics. That's the need, or phonetic awareness, or in the child's system. Now, some children that is the primary thing that is involved in their symptoms is phonetic awareness. They do fabulous on the current dyslexia regime of the 2-year phonetic approach. But then there's others that certainly do not do well, and they may have these other issues. So let's think about this. I'm going to teach you some things today to check at home, and actually what you can do about eye issues if you see those happening. Most of us know about acuity. Acuity is how you see up close, how you see far away. And that's the first thing you do when your child has reading problems. Typically, you take them to the eye doctor and try to find out what's wrong. Most of the eye doctors are looking at just acuity. Again, how do they see up close? Does it need to be magnified so would they see it easier? Or how do they see far away? And this would be problems like um, copying from a board or something like that. So we've got that covered, but they're still having problems. So we need to look a little bit further. The first thing is tracking the eyes moving across from left to right smoothly. If they don't have good tracking, they could be going across and their eyes skip back, and it could be over part of a word or over a whole word, and it causes lots of confusion in the brain. It's like that garbage in, analogy is not giving good messages to the brain. So, what you can do to check your child is if they're a little bit smaller, you want to have a little finger puppet or a something like a sticker on the end of a pencil, something small that they can watch. If they're a little older, you might use something like this. You're going to be about 15 inches away from the bridge of their nose. So you're going to be out away from them and you're going to have this object track horizontally and also vertically. But along the way, what we want to make sure of is that they're actually tracking the object and not just moving their eyes that direction because you're going that way. So, to make sure about that, what you do is you take this, you go across, and then you're going this direction, but you backtrack just about an inch and keep going. Then you come back, and then in some random place, you just backtrack again. Then the same thing is going to go for the vertical. Now, what you're looking for is those eyes, both those eyes going right with your object, and not jumping ahead or losing it, and then they have to come back to it. So, what I want you to do is have them cover one eye and do this tracking with the eye that's uncovered. Then have them cover the other eye and do the same tracking with the other eye. Now, some people, when they're tracking, they go way over to the side. You really want to make a little box around them about shoulder width apart. So here and here. And that's the width that you're going to go, not much further than shoulder width from one side to the other. And the same thing up and down. You don't go way up because their head's going to stay straight with you. And you say, don't move your head, just move your eyes. And then they're tracking. So check on that. And then if that's a problem, oftentimes what happens is they track across a line, and then when they come back, they're on the wrong line. So this can cause lots of confusion in comprehension because they've lost their place. They're not tracking across, and then their eyes moving smoothly back, uh, and it can cause other things along the way where they are jumping over words or they're rereading words or things like that. So check on that. And then what we want to talk about is convergence. Convergence is the eyes working together, coming in smoothly together and coming back out smoothly together. So what you're going to do is start close to you, and then you're going to aim toward this point right between the two eyes. And you're going to come in with this object. Obviously, both eyes have to be together, and then you're going to come back out. So you can check both of these at the same time by doing some tracking and then coming to the center, coming in, coming back out. And what you're looking for is, again, those eyes coming in together. If as they're coming in to about 2.5 inches close, I forgot to mention that. So you're aiming here and you're coming about 2.5 inches from that spot. As their eyes are coming in, if all of a sudden one just kind of goes off to the side, that's what we call a divergent strabismus. It's like the eyes quit working together at that point, and only one of the eyes is falling in and the other one is lost. So what this can do is one eye places the image on top of the other eye, and if that's not happening correctly, it can cause things like this. So it can cause the words to look blurry or look the like there's rivers running on their page, or words can just move around if that's the problem. So you're going to check with both eyes open for the convergence. So you start here, come in, and again, come back out. If as they're coming out, one of them just stays in, that's a convergent strabismus. So that's again where the eyes are not working together, giving garbage in to the brain about what the child is seeing. So you can imagine if the child has got one of these issues, that there's going to be tremendous confusion to the brain because they're not getting good information. So let me tell you what you can do if you find that this is an issue for your child. You would practice every day because we feel like it's an eye issue. So one of the things that controls this area of your like your eyes, your nose, your lips, your mouth, all this area is called the trigeminal nerve. It's one of the largest nerves in the body, and you can do some stimulation of that nerve, about a minute or so, a couple of times a day, just before you do this tracking, and that will help uh, build those pathways so that the brain is recognizing uh, what they're seeing and what they're doing. The we believe this is a muscle issue, so it's just like, you know, uh, doing your push-ups or your pull-ups every day, you're building those muscles. You build the eye muscles the same way. So you're going to take your object that you're going to be using. You want to set a timer for about 2 minutes, and you're going to do this twice a day. So they're going to cover one eye, and then you're going to have them track with that eye, and you can come in and out too, and then track. Then that's for just a few seconds like that. And then you do the other eye, same thing. You're retracing, having them watch that object wherever it goes. And then you do it with both eyes. You just keep that cycle going, one eye, the other eye, both eyes for that 2 minutes. And you'll find that as you're coming in, you'll find that over time they can come in farther and farther until they can do it about 2.5 inches. Now, so we're looking at eye function. Can they see it? Acuity. Can they track it? Eye tracking, and can they see it with both eyes giving the right kind of information? That's convergence. Now, there's another area that we found that's involved with a lot of children that have learning challenges, especially reading, and that's their central vision. That's how they see right in the center. So if this is a problem, they see more peripherally and they don't see right in the center. Now, I'm going to give you this. It has nothing to do with dyslexia, but it could have something to do with your behavior challenges that you may be having. Thinking that it's behavior and it's really developmental. So when you ask your child to look you in the eye when you're talking to them, and they do that, they move their eyes right toward you, and then pretty soon it's just kind of like they're looking over your shoulder. That could quite possibly mean that they're using their peripheral vision to see you because their central vision isn't working. So they bring their eyes there because they know that's what you want, but they can't really see you here. So they have to do this to see you well. So you want to be aware of that, and if that's an issue, that's really a developmental issue, not a behavior issue. It's not like, I mean, typically we look away when we're in trouble or something like that. But if you're just having a conversation and you're saying, "Look at me when I'm talking to you," um, and they're doing that, it could be the central vision challenge. Now, think of that on the scale of reading, and they're reading along on the line, and letters disappear in the middle of a word. This can cause things like saying a word that's close to that word, but not the word that's on the page, like saying a word that starts with SH, but not the word that's written. So this is just their way of compensating for what they're not seeing correctly. Now, they don't know any different because that's how they've seen all the time. They don't know a way to tell you about that. But there is a way to work on that. It's more involved and something that we would need to help you with through a therapy kind of activity. So, just keep in mind that dyslexia is multifaceted. The symptoms are caused by some kind of glitch in the brain, but the good news is that plasticity of the brain that we talk about in neurodevelopment can change everything for the child. It just needs the right kind of stimulation to come in to give that good input so that there's good output. Typically, we see a year improvement in reading every 4 months, and also oftentimes in math when they do these kinds of neurodevelopmental activities. So, if you want more information about this technique, you can go to brainsprints.com and find out about the Foundations program. We have free consultations that you can take advantage of there that will give you information directly to your inbox and so you don't have to hunt around, or you can go to that dyslexia page. And if you're one of those that likes to really go in deep, we've got articles that you can read and obviously other things that you can uh, look at here on the YouTube channel. One other thing I want to make you aware of is neurodevelopmental screenings. So whether we do those virtually by Zoom or in person at our locations, we are close to McKinney and Conroe and Palestine, where our home base is in Palestine, Texas, are where the in-person ones can be done. And then we also have virtual screenings as well. These screenings take the key aspects of the different areas that could be causing challenges for dyslexic children, and we identify what those are, and then we can give you a plan of intervention that you can do at home. That's all for now. If we can help you with anything, just let us know. It's brainsprints.com if you want that more information. And join me each week on Wednesday at 1 o'clock. Join us in the chat for your individual questions. See you next time.